Okay, I'm back for cough. Melissa, this one is for you especially. So, this is like anxiety in kids. Like, we could talk about cough for hours and hours. So I'm just gonna hit the tip of the iceberg. So your kid is coughing. Let's just think about why they're coughing. So I wrote a little, I'll post this better. So do they have snot? Do they have upper respiratory congestion and they have a cough with it? Or do they have no snot and they're just coughing? What's going on? So that's the quick way of breaking it down. So let's just talk about nasal congestion. When kids have upper respiratory infections, part of the body's way, the immune system fighting that upper respiratory infection is by generating mucus. And we all know that our kids can generate a ton of mucus. So in generating the mucus, the same mucus that's in their nose gets in their lungs too. That's good. It's protective. It's helping them get rid of the virus. What happens is you have little hairs kind of in your lungs, like little fingers called villi that work that mucus up to the back of your throat. And then that triggers you to cough. So, parents will say, well, it's a dry cough. It's a wet cough. It's a productive cough. All of those things might be okay, or they might not. And I know you're probably thinking now, well, that's totally unhelpful. But let's just kind of break it down. So you have nasal congestion, you have cough, your kid's coughing. What do they look like? Are they breathing normally? Look at their belly. Look at their necks. If they're pulling like this, pushing the air out, you can see their belly moving. This is respiratory distress. That's a problem. If they're totally fine, they're running around, they're happy, they're playful, cough here, there, a little bit of cough at night, that's all okay. If you really want to be thorough, and again, this is just me as a mom and a physician. It is not taking the place of your pediatrician. The original stethoscopes were the physician's ear to the patient's back. You can always just listen to your kid and have them take a deep breath. And a lot of the weird breath sounds we hear are transmitted upper airway noises. It's transmitted snot. So if you hear that, have them blow, have them cough, see what they sound like. If you have any doubts, call your pediatrician, get in, have them looked at. But for the most part, cough is good. Cough is protective. Cough is getting that mucus out of their lungs. I might have to think on this a little while, but I cannot think of a reason right now that I ever advise cough medicine. Because again, we want to clear that mucus out. We want to get that junk out. We want for them to clear it out. Let's say let's just flip to no snot real quick. No snot at all and coughing. We would go down a rabbit hole with this, but just think about the history, right? So you have no snot. Why are you coughing? Do you have asthma? Looking at the chest, looking at their neck, looking at their belly. Are they having trouble breathing? Maybe they're just at the beginning of an illness. They haven't started with the snot yet. Maybe they have asthma. Maybe they need a breathing treatment. The little kids, so the little toddlers, and sometimes we see it in older kids too. If a kid is eating, and the boys were militant about this, and I think they still are to a certain point. So we always avoided choking foods, right? Popcorn, peanuts, Skittles, M&Ms. They did not have any of those foods. Whole grapes. The grapes got cut up into tiny pieces. If a kid is eating one of those things and has a choking episode, has respiratory distress during the choking episode, maybe vomits, and then after continues to cough, they need to be evaluated. So again, PCP, ER, someone needs to take a look at that kid, because we do see pretty often kids aspirating objects that they eat, foods that they eat. I'll be super honest with y'all. Henry was a choker. Twice when he was little, he choked on fruit, and not big chunks of fruit. Like, I cut the fruit tiny, and he did it, and it's terrifying. So in talking about that, I'd also say just get trained in basic life support, in CPR, in knowing what to do if your kid chokes, depending on their age. It's just the safe thing to do. So let's switch back real quick to snot. So when little ones wheeze, and so let's say we're talking about babies now. Let's say you have a 4-month-old that wheezes. We know you probably heard about RSV. It's respiratory syncytial virus. It's a beast. So in adults, it just makes us feel terrible. Lots of snot, coughing. In kids, it's like, it can really be devastating to a newborn or a little baby. And so they are, I kind of say they're drowning in mucus. So they're producing mucus at an incredible rate, and they don't have a strong enough cough to clear it. And so what they'll do is have all that increased work and breathing that we talked about. And then sometimes you'll hear them wheezing as well. And so we get this question all the time, and this is like one of my favorite pictures to draw. Well, if they're wheezing, why don't you give them albuterol or a breathing treatment? Because my asthmatic that's 6 is wheezing, and you're giving them a breathing treatment. So I don't understand. So here's what we got. I like to draw simple pictures. So if you look at the airway, like a cross section of an airway, this is what it looks like. It's parts of your lung, what it looks like. In asthma, you get bronchoconstriction. So your airway shrinks down small. That's why you get the wheezing sound. When you give albuterol or a breathing treatment, which is a bronchodilator, that airway dilates back out, gets back to normal size. When you have bronchiolitis, that airway is pretty normal. Normal size, except that it's filled with mucus. So the middle part is smaller, but if you give a breathing treatment, you can't make it bigger. You can't make the outside any bigger than it already is. So this is why breathing treatments do not work in bronchiolitis. Okay, so albuterol, if you have a 4-month-old that's tons of snot, difficulty breathing, wheezing, albuterol is not going to help them. And there's been a lot of research on this, okay? I promise. Also, steroids are not going to help them. Asthma is a different beast, and we can conquer that another time. I did want to touch on croup real fast, because that's another reason they cough. So croup is virus just like anything else. Most of the time caused by para-influenza, but it can be caused by other viruses as well. And so some kids are croupers, some kids are not. I was not a crouper, never, I don't think ever in my life. My husband was a crouper. Both of my boys are croupers. And so it happens more when they're younger, but it can happen still as they get older. So they get the snotty nose, maybe they have the fever, maybe they start with a little cough, and inevitably, always, in the middle of the night, you wake up to and that is called stridor. You wake up to that noise, and you wake up to a barking cough. It's like a seal bark is how it's described. I'm not going to do it because I feel like I look ridiculous when I try to do it. But I will post a video of Henry when we were in Dallas one night, and he woke up in the middle of the night with it. So your upper respiratory infection, your bronchiolitis kids, they do good with warm, moist air. So, hot, steamy bathroom, really get that snot out. Croup kids, because what croup does is it inflames the upper airway. And so with croup kids, when they take a deep breath, this is a little swollen, so you get that noise. So croup kids do better with cold, dry air. So if your kid wakes up in the middle of the night and you live in Louisiana and they have stridor, you may not be in luck for the cold, dry air outside. The things you can do inside, you can open the freezer and hold their face in front of the freezer and let them breathe in cold air. You can, which I've done this many times, bring them out to the car, sit in your driveway, crank the AC, and let them breathe in that cold, dry air. If it is cold where you live, you could strap them in their car seat, drive around with the windows down for a while. I can't tell you how many kids we see in the middle of the night for croup, and the parents say, I swear they sounded bad. And then by the time they get to the hospital, they sound better. And we're like, we believe you because it's cold and you got them out in the cold air. And so that's how they got better. So that cold, dry air really helps. And the other thing that helps with croup is steroids, Decadron, just to decrease that swelling. So that's one thing that steroids do is decrease the swelling. And we'll talk about steroids and upper respiratory infections and why you shouldn't get a sinus infection shot of steroids. That makes me crazy, but we'll talk about that another time. But if your kid wakes up in the middle of the night and has stridor and has croup, you can try your things at home like we just talked about. But if they're not getting better, then they do need to go to the ER. So when I show you the video of Henry, if your kid looks like Henry did, go to the ER. I was just very comfortable dealing with it at home, so it was fine. Okay. I think that's good for today. There's so many more things to talk about when it comes to cough. But at the end of the day, if your kid is eating, drinking, you look at their chest, they're looking good. They're not having those pulling breaths. They're not coughing to the point of turning blue or can't catch their breath. Then that cough is probably okay and protective. Again, not taking the place of your pediatrician. I'm just giving you some advice that I give to my families when we see them in the ER. All right, you guys. Happy Saturday. Happy game day. Go Tigers. I'm going to go check on my kids.